How to look after yourself at home when having coronavirus. But first, let's take a quick overview of the COVID-19. Coronavirus disease or COVID-19 is an infectious disease caused by a newly discovered coronavirus. It is an illness caused by a novel coronavirus now called severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, formerly called 2019 nCoV, which was first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei Province, China. It was initially reported to the WHO on December 31, 2019. And on January 30, 2020, the WHO declared the COVID-19 outbreak a global health emergency. On March 11, 2020, the WHO declared COVID a global pandemic, its first such designation since declaring H1N1 influenza a pandemic in 2009. COVID-19 affects different people in different ways. Most infected people will develop mild to moderate illness and recover without hospitalization. How it spreads. The virus that causes COVID-19 is mainly transmitted through droplets generated when an infected person coughs, sneezes, or exhales. These droplets are too heavy to hang in the air and quickly fall on floors or surfaces. You can be infected by breathing in the virus if you are within close proximity of someone who has COVID-19. Or by touching a contaminated surface and then your eyes, nose, or mouth. And now, let's discuss what you can do at home if you contain the COVID-19. Treating a high temperature. If you have a high temperature, it can help to: first, get lots of rest. Second, drink plenty of fluids and water is best. To avoid dehydration, drink enough so your pee is light yellow and clear. Lastly, take paracetamol or ibuprofen, if you feel uncomfortable. Next is treating a cough. If you have a cough, it's best to avoid lying on your back. Instead, lie on your side, or sit upright. To help ease a cough, try having a teaspoon of honey. But take note, do not give honey to babies under 12 months. If this does not help, you could contact a pharmacist for advice about cough treatments. Next, things to try if you're feeling breathless. If you're feeling breathless, it can help to keep your room cool. Try turning the heating down, or opening a window. Do not use a fan as it may spread the virus. You could also try breathing slowly in through your nose and out through your mouth, with your lips together like you're gently blowing out a candle. Sitting upright in a chair, relaxing your shoulders, so you're not hunched, leaning forward slightly. Support yourself by putting your hands on your knees, or on something stable like a chair. Try not to panic if you're feeling breathless. This can make it worse. Next, if you have a pulse oximeter. A pulse oximeter is a device that clips on your finger to check the level of oxygen in your blood. Low levels of oxygen in your blood can be a sign you're getting worse. A pulse oximeter can help you spot this before you feel breathless or have any other symptoms, so you can get help before it becomes more serious. You may be asked by your GP or healthcare professional to monitor your oxygen levels if you're at a high risk of becoming seriously ill from coronavirus. If you're using a pulse oximeter at home, make sure it has the CE mark on it, which means it meets health and safety standards. It might help to write down your readings. Keeping a record of regular readings makes it easier to see any changes. It can also help if you need to speak to a healthcare professional. If your blood oxygen level is usually below 95, but it drops below your normal level, it's best to consult a doctor for advice. Lastly, What medicine you can take when having mild symptoms of COVID-19. For pain medication, the most useful medicine is something to decrease headaches, body aches, and fever, like acetaminophen, Tylenol. Many people also use ibuprofen, Advil or Motrin, but there has been some concern, especially from Europe, that ibuprofen is less safe, though there's no direct evidence that this is true. Still, if you want to be extra careful, use acetaminophen instead. For cough medicine, if you have asthma or any other respiratory condition, it's essential that you continue to take your routine respiratory medicines, and follow your asthma action plan or any similar instructions from your doctor for the use of rescue medications. Over-the-counter cough medicines aren't effective, but can be tried. Honey, or cough drops containing honey, may also help to soothe coughs. Prescription medicines. If you have asthma or another respiratory illness, be sure to have extra inhalers and other medications on hand. The same is true of any other chronic illnesses you may have, since having conditions such as diabetes, heart disease, and immune system disorders place you at higher risk of serious complications from COVID-19. Ensure that you have a 4-week supply of prescription and over-the-counter medicine. Zinc. Zinc has become one of the most popular suggestions for reducing symptoms of coronavirus. Although there is no direct evidence at this time to suggest that using zinc lozenges can prevent or treat COVID-19 in people, zinc does have antiviral properties, and was shown in a laboratory study to inhibit the replication of coronaviruses in cells. Vitamin C. It supports the activity of our immune cells, especially when they work more than they should during outbreaks. It is important to take vitamin C on top of a healthy diet that's rich in fresh vegetables and fruit. Herbal remedies like turmeric and ginger. They both have incredible anti-inflammatory properties, and also very high in antioxidants. Further, ginger is full of chemicals that fight off cold and relieve stomach-related problems. Turmeric also has hundreds of active chemicals, and is a great pain reliever. You can either add them fresh, or juice them, to get the full spectrum of benefits. Having said the different home remedies, it is still important that you also take care of your mental health during self-isolation. And it is important to remember that if a fever remains very high, or if a patient's symptoms are causing discomfort, they should contact a healthcare professional for further advice in the next step. Staying at home for a long period of time can be difficult. It can be frustrating and lonely for some people, and you may feel low, particularly if you have limited room or access to outdoor space. It's important to remember to take care of your mind, as well as your body, and to get support if and when you need it. Stay in touch with family and friends over the phone or on social media. Think about things you can do during your time at home, such as cooking, reading, singing, painting, online learning, or watching films. If you feel well enough, you can take part in light exercise within your home or garden. When you are feeling better, remember that physical exercise can be good for your well-being. Look for online classes or courses that can help you take light exercise in your home. If you like this video, don't forget to like, subscribe, comment, and hit the notification bell. Thank you so much. Stay safe and healthy.